Now, moving to the next, trying to hammer more on Tetralogy of Fallot. We'll look at the clinical features of the Tetralogy of Fallot. That's more of like we're looking at the signs and symptoms, right? If a patient comes with Tetralogy of Fallot, so as you are doing history taking, what are the things you'll be looking out for? Or during physical examination, what are the things you'll be looking out for? So let's look at it. Now, this is Tetralogy of Fallot, okay, where you can see what the normal heart anatomy. I can see the heart anatomy in Tetralogy of Fallot. You can pause this to observe it. It's something we have spoken about several times. So clinical features just reflect what? Its nature as a cyanotic congenital heart defect. When we say something is cyanotic, it has a tendency of making your skin becoming bluish. Your extremities, to be particular, you understand? Your tongue, your lips, your hands, your legs becomes bluish. So symptoms may vary, and this is depending on what? The severity of the issue. Do you understand? And when the patient presents. So the first sign you look out for is what? Cyanosis. So there's a bluish discoloration of the skin, the lips, the nail bed, the fingers, the toes. I've spoken about that. So it often appears within the first week. Okay, they will have teeth spells. I didn't actually bring all those pictures here, but it's things I'll still talk about them one by one. So if you want to know in depth about what any one of them actually mean, just let me know. So teeth spells are also known as what? Hypercyanotic episodes. Like those ones, there's a sudden episode of the bluish discoloration of the skin, the hand, and all of that. There's rapid breathing, irritability. It's triggered by crying, feeding, or defecation. May lead to fainting or even seizures if prolonged. Heart murmur. There's some crazy heart sounds like that. Then harsh systolic ejection murmur is heard best at the left upper sternal border. So it's caused by turbulent flow. Okay. You have clubbing of the fingers and toes. It's seen in chronic hypoxia, painless thickening of the fingertips. That's like clubbing, right? Yeah, kind of like clubbing. Poor feeding and failure to thrive. Infants may tire easily during feeding. Inadequate weight gain and growth. Okay. Then we have dyspnea on exertion. That one, like if you don't tell them to walk a bit, be climb and upstairs, they have severe difficulties breathing. Okay. So less common features, you have irritability and lethargy due to hypoxia. Then if it goes on for a very long time, the body is trying to compensate by producing more red blood cells. Okay. Then neurological complications, there's a risk of stroke, brain abscess, if the blood supply or oxygen supply to some brain tissues is not adequate for a very long time. Okay, so those are the possible signs and symptoms you are looking out for in Tetralogy of Fallot.